I'm really excited to be starting off this segment of the learnings today about the kickoff event. And the reason for that is I love the kickoff event. Of the entire 6 building blocks sort of approach, the kickoff is so much fun and so rewarding. So I hope that you can feel that and think about how to make a kickoff event your own for your sites. So there are going to be 3 of us actually presenting, I believe 3 of us presenting on this topic. I'm going to start off talking a little bit about kind of the basics of the kickoff and then how to help a clinic identify patients using opioids and then what kind of data you might want to collect once you know who they are for the kickoff. And then we'll cover kind of how to facilitate the self-assessment discussion, which is a really rich part of the kickoff event. And then finally talk about that first action planning meeting with the opioid improvement team. So in terms of the kickoff basics, one of the things that I heard a lot of conversation about in the discussion that Katie completed before the break was about buy-in, and it was about consensus, not only with leadership, but also across the clinic. So the kickoff is just a wonderful way to really launch that buy-in, particularly across the clinic. What the kickoff is it's a time when everyone from the clinic who has some connection to the process of caring for patients who have chronic pain and are using opioids come together at the same time to learn about the 6 building blocks program, provide their perspective on the care that's being provided to the patients, and think about or learn about what's going to happen in terms of what's next for the program. What we've learned from clinics is that sometimes this is the first time that the entire clinic has come together. Some clinics told us, wow, we've never had administration, staff, front desk, medical assistants, nutritionists, behavioral health, providers, all in the same room at the same time talking about a quality improvement initiative. So it can sometimes be kind of a landmark event for a clinic, and it's really, they really enjoy it. It's a time to help ensure that the whole clinic really understands what this 6 building blocks effort is all about. I mentioned the buy-in. It definitely helps develop buy-in. And it's a time to really highlight, why are we doing this work now? What's so important? What's our need for this work in our clinic, and to really personalize that. Because there are small group activities where we're asking everyone to speak up, it ensures that everyone across the clinic has a voice. Front desk, medical assistants, nurses, behavioral health, everyone who's there has a chance to weigh in with their perspective, which is very empowering. In addition, I don't know about in your clinics, but in my clinic, a lot of times what happens is one side of the clinic develops a really good idea and implements it, but the other side of the clinic doesn't necessarily know about it. So this is a time where all of a sudden there's a lot of conversation about how things are happening in the clinic on one team or another, and that can produce or harvest some really good ideas that are actually already happening but might need to be further disseminated. And finally, the opioid improvement team, which would have been meeting with you as a practice facilitator in that prepare and launch phase, is going to be at the meeting, will be introduced, and it kind of solidifies and grows that relationship between the opioid improvement team and the work that they're going to do with the clinic and their perspectives and all the members of the clinic. So this is what the agenda looks like. We followed a pretty consistent agenda every time we've done a kickoff, with the first piece being an overview, and this is something that the practice facilitator provides, an overview of the evidence. So introducing clinicians and staff to, what's going on with opioids in our region. So oftentimes we'd show a map of the nation and prescriptions and perhaps the county and prescriptions or something like that. What are the existing guidelines, regulations, rules in your state around opioids? And what's the background and the purpose and the approach of the 6 building blocks program? So that's the first segment. Next comes an opportunity for a clinician leader from the clinic, someone who, usually this is the clinician champion on the opioid improvement team, who talks about why this work is important to the clinic. And this is really a great place to build that buy-in, to motivate the clinic. Knowing that leadership is behind the work helps really get people on board. And making sure that it's really about the people, about the clinics, about the patients, and why it's important for patient safety and improving the work life of the staff and the providers in the organization. Generally speaking, in this part of the presentation, there's both kind of a story as well as data that's provided. I've seen clinician leaders tell a story about one of their own patients that they lost because of opioids and the impact on them as a provider, on the staff caring for that patient, as well as on the family. It's very moving. In addition, if there are data that can be presented on number of, the level of the morphine equivalent dosing, variation in opioid prescribing, that can be very helpful as well. The third piece now comes to these small group discussions. So in this, and there's going to be more conversation about exactly how this works, but this is the opportunity for folks to really share their perspectives on what they perceive as how the clinic is doing on these 6 building blocks activities. And then after a period of small group discussion, those small groups come back together into the large group, this is number 4, and have a greater discussion about what they identified. Was there agreement across the group in exactly how they classified how the clinic is doing in these different things? And what we normally find is that there's actually a lot of variation. Like within a group, one person might say, yep, we've got policies, I follow them every day. And the other person in the group might say, I don't know where those policies are. I don't think we're doing that. So there's a lot of variation there. And then the final is kind of what's the next steps. This is a great time for the practice facilitator to introduce the clinic to the website, point out the materials that might be most helpful to them, let them know kind of that the opioid improvement team is going to be developing an action plan right after the kickoff. There's a kickoff survey that the clinics may want to administer, and that can help inform the team. So asking them to complete the survey and return it. And then if the opioid improvement team has any requests of the larger clinic, because everybody's together at the same time, this is a good time to make those requests. So something like, gosh, we're going to start using a diagnosis code for long-term opioid therapy. So please use this code, those kinds of things. And of course, it's a time to say, please continue to share with us your ideas and your thoughts. This is just the beginning. We're going to be doing this work. We want to hear from you. So it's a very, very rich agenda. You'll see that we have a lot of resources, as you know, to support the practice facilitator in conducting the kickoff. So we have a PowerPoint presentation that's kind of that first segment. We have a manual that walks through step by step. We have an example of the kickoff survey. It includes a survey about burnout, so that if you want to measure burnout before and after implementing the program. And then it has some of the resources that you would need for identifying patients, the self-assessment, the website, etc.